Amyotrophic lateral sclerosis, or ALS, by Jessica Davis, Dr. Irwin's Biology Class, 1107. Amyotrophic lateral sclerosis is often referred to as ALS for short, or commonly called the Lou Gehrig's disease. It is named the Lou Gehrig's disease after the famous New York Yankees Lou Gehrig, who passed away from ALS. Amyotrophic is from the Greek language, literally meaning no muscle nourishment. With no nourishment, the muscle wastes away. Lateral is referring to the spinal cord, where the nerve cells that control the muscle are located. ALS is a progressive neurodegenerative disease that affects nerve cells in the brain and the spinal cord. Motor neurons reach from the brain to the spinal cord and from the spinal cord to the muscles throughout the body. When the motor neurons die, the ability of the brain to initiate and control muscle movement is lost. With muscle action progressively affected, patients in later stages of the disease may become completely paralyzed.
All voluntary movement in the body is controlled by the brain. Nerve cells in the brain, called upper motor neurons, initiate movement through the release of chemical signals called neurotransmitters. The signal is passed from the upper motor neurons to the lower motor neurons of the spine. Nerve fibers extending from the spine, called axons, extend into the muscles. The point where the axons and muscle fibers connect is called the neuromuscular junction. When the signal reaches the neuromuscular junction, it causes the muscle to contract, resulting in voluntary muscle movement.
Jean-Martin Charcot first noted reports of the characteristics of ALS in 1874. Jean-Martin is a noted French neurologist who was called the father of neurology. Symptoms of ALS include muscle weakness in the hands, arms, legs, muscles of speech, swallowing, or breathing. Some patients have twitching in the hands or feet muscles. Thick speech or inability to project the voice is also common. In more advanced stages, patients have a hard time breathing and swallowing. Approximately 5,000 people are diagnosed yearly with ALS in the United States. Currently, there are about 30,000 people in the United States affected by ALS. Majority of people have the onset of ALS between the ages of 40 and 60 years old. ALS has no racial or ethical bias. However, men are more prone to the disease than women. Due to the loss in muscle control, family members of patients with ALS must help their loved ones with even the simplest everyday task, such as tying their shoelaces. Men will need someone to shave their faces due to their inability to hold the razor. ALS patients in later stages cannot even feed themselves due to the loss in muscle. ALS is a very difficult disease to diagnose. There is no one test or procedure that can be performed to determine if a patient has ALS or not. There is a series of diagnostic tests that will be performed before a diagnosis can be made. Tests include, but are not limited to, X-rays, MRI, muscle biopsy, spinal tap, and electrodiagnostic test. As of today, there is no cure for ALS. Many researchers are working hard to find a cure to save the lives of those affected by this horrible disease. Experiments have shown that neuron stem cells transplanted into multi-level of the spinal cord have slowed the progression of the disease. ALS patients are given prescription drugs to help keep them comfortable and prevent the patient from living the remainder of their life in pain. Some patients may also go to physical therapy to help keep the muscles built up and to try and slow the degeneration process down. Average lifespan for patients living with ALS is 3 to 5 years from the time of diagnosis. 15% of patients live less than 3 years. 50% live 3 to 5 years. 25% live 5 to 10 years. And a mere 10% of known cases have lived over 10 years.